Hi, my name is Paul Cherashore. I'm from the Philadelphia Overdose Prevention Initiative, also known as POPPY, and I'm here with Bishop Dionne Butts of Greater Restoration Worship Cathedral, who is also a drug and alcohol counselor in the area, and Dan Martino of Old Richmond Civic Association, who's currently running for the 177th District PA Assembly seat that's being vacated by the retiring John Taylor. We are here to talk about supervised injection sites, also known as supervised injection facilities, SIFs, and also in Philly, comprehensive user engagement sites, or CUEs. As most people know, after a long period of public debate that started last March, and after the eviction of the homeless encampment up in Kensington, known as El Campamento, the city announced in January that they are moving forward to assist an as yet unnamed nonprofit or a consortium of nonprofits to open one or more sites. The city has announced that it will not fund the sites, only facilitate their opening. We are now in a period of extended public debate about how to move forward, and there has been significant opposition from various sectors, the recovery community, most heavily impacted communities, geographically speaking, and various political figures. Welcome, Bishop Butts and Dan. Can you briefly tell me about how you came to take positions on supervised injection sites?
One of the things that has always been pressing for me is the substance use disorder world. And so how I actually became involved in this fight against the opioid epidemic, the safe injection sites, we have a outreach ministry by the name of Compassionate Hearts, and we are literally on the streets in Kensington providing outreach to those individuals who are actually crippled by this opioid epidemic. Soul Collective is another organization that we are very much connected with, who provides harm reduction training, who provides needle exchange and other outreach. Then offered me an opportunity to come along with this coalition and to fight this war on opioids. And so that's kind of how I really got involved.
I come from a neighborhood near Kensington, right off of Lehigh Avenue, and I joined their civic association a few years back, and I was asked to manage their town watch. And the further you look into it, you realize that there's a ever increasing heroin epidemic that's happening in Philadelphia, and we are right on the front lines of that area. And so in order to kind of manage that more responsibly, I had to look online to see what other countries or other cities and states have done to try to kind of tamp down some of that. Injection facilities was one of the things I found that seems like something that I thought Philadelphians could reasonably tolerate. So for the most part, it was just a way to address the crime that unfortunately comes with drug addiction, because it is such an expensive thing, but also to deal with the injustice and inhumanity with having people who are living on the streets. We have a lot of barriers when it comes to getting into rehabilitation or housing. And those are the things that we needed to address in order to find our way out, because right now it gets worse practically every day. It seems like it gets worse. And that just doesn't, I just can't accept that. And instead of pushing it around the city, or we were just talking about this, it seems like gentrification is something that people have talked about as being a potential solution. And it's like, it's not really a solution. You're really just moving this problem from one area to another. Yes. And I think we can be a lot smarter than that, or we have to be a lot smarter than that if we really want to take care of this in a responsible manner.
I definitely wanted to touch on your comment about gentrification, Dan. Over the summer, we did a brief interview with the developer of the Allegheny Plaza Shopping Center. He had some interesting insights about why changes are happening in Kensington right now.
I never thought in my lifetime I would see Kensington as being a gentrified neighborhood. But now that people are wanting to live there, and it's now become something that's positive, people say, well, why does this exist? I mean, to me, it's a sad statement that it took a gentrification for people to say, this shouldn't be.
So what do you see as the obstacles that are the chief ones that are keeping the city from moving forward and actually implementing the CUES intervention that they've talked about?
There's a lot of misinformation There's a lot of hysteria around the issue. You know, there's a lot of unanswered questions, and when there's questions that don't go answered, people make things up. They hear something like a, shooting gallery or a shot clinic or something like that. They think that it's going to end up being right next to their home, but in reality, the whole point of this is to create a place where this is no longer visible to school children or to neighbors, and that's something we need to talk about.
Let's take a look at some of the footage recorded by our reporter Sterling Basil Jones up at the site of some of the homeless encampments. He talked to many of the most impacted members of our community.
But I've heard about the safe injection sites. It's a place for us, people like us, heroin addicts, to go and, be able to be a safe place to use drugs, use the heroin. I think it's a very good thing.
Me personally, I think it's a good idea because you get to keep your eye on the people, and I basically control it, have a little bit of control of it. It's a lot of diseases going around too, so the needles would be inside the spot. Yeah, so that you can get rid of the needles right there, because I see kids step on them. I seen over the summertime kids stepping on needles and playing with them outside.
One of the things is the stigma that's related to substance use disorder. A lot of people are not aware or educated about the causal factors or the contributing factors about substance use disorder.
Is that we have to start listening to each other instead of screaming over each other. Listen to the people who've lived with this and talk about what works and what doesn't.
Absolutely.
Listen to, for instance, the Qs that we're talking about. They're endorsed by the American Medical Association.
Though some doctors and nurses that are still resistant to it.
Sure.
I think one of the major issue is location, because people will say, well, I don't want it in my community.
Everybody's, right. Nobody wants
no one wants it.
Nobody wants these at all.
Yeah.
But objective reality exists, unfortunately.
Exactly. But coming up with a solution, at the end of the day, we should be concerned about the lives of those who are, impacted by it. We should be concerned about the ramifications of us not doing something about it. People were very resistant about the whole needle exchange, but it reduced the rate of HIV.
Right.
There's no help without understanding, without awareness, and so we need to make people more aware of the benefits of the safe injection sites, because people are doing Canada, Vancouver,
Germany, Portugal,
Spain.
And this is another point too, is that people expect these to solve all our problems, and this is one tool in the toolbox. This is not going to solve everything. Essentially now we have to deal with a situation where we live in a world where heroin is a constant.
Yes.
We need to find a way to manage that so that it's not on the street killing people face down in the gutter. It's become such a problem.
You mentioned that this is programming that has been conducted for many, many years overseas. In November, I visited 2 sites, one in Amsterdam and the other in Frankfurt, and conducted brief interviews from staff members. We're now going to show you one.
We have now 9 countries in Europe who has rooms, and almost all of them are maintained it on a very stable base. And for example, in the Netherlands, we had a survey under the neighborhoods of those rooms. We have about 27 rooms in the Netherlands, and all the neighbors were perfectly all right with the rooms, even if they argumented a lot before the opening, but after it runs, they are all convinced that it's a very effective tool.
Do they just sit around the room and inject on, they have desks? Or?
They have desks, and it is also for injectors and smokers at the same time. That's not a problem. We don't have medical staff. It's we only have very few emergency situations over the year, and in case of an emergency, we can call the ambulance. We will be there within 5 minutes. So it is not so expensive to run the room.
And I wanted to go back to one thing that you did say earlier, and that is that we've tried other interventions. We talked about this, that a lot of what we have now in the city, and especially up extending east on Lehigh Avenue, is a reaction to the eviction El Campamento. And there are calls now from some, even in city government, to just say, let's just get rid of these people. Would you have an answer for that?
Well, what does that mean? Get rid of
Right.
these people? You know, like the big problem that with El Campamento is that you can't keep pushing these populations to different neighborhoods, because then you're not solving anything. There's 70,000 Philadelphians right now injecting heroin. That's 1 in 22 people.
And it's a larger overdose rate than the homicide rate. You
Right.
know, 64,000 when you look at it nationwide.
Right.
That's
And
contributing
1,200 in
to.
Philadelphia with the highest overdose rate
Right.
per capita in the country.
Right.
And it's difficult to beat. You know, so you
So-
can't beat them, treat them.
Are you optimistic going forward?
One of the things about the supervised injection sites is that it provides a avenue for people to get help.
You know, it acts as a bridge between active addiction and treatment.
Well, thank you both very much. It's
Thank
been a
you.
very enlightening discussion, and I appreciate you appearing on this show.
Thank
My
you.
pleasure.